Good afternoon.
Yes. Doing
Yes, we have been in contact with Anna and Jeff, and also good for the organization. Yes, we are trying to bring the delegation and shows in the previous which was really interesting. So we did we are going there for this week. It's a very informative venue. Congratulations for organizing as in this recording. It's really good. It's relaxing. Yeah, very important. A much more honest debate than what we are used to in Brussels. So it's real interaction. It's really useful.
Well, thank you very much. We're going to start. First of all, thank you for coming. For us, it's important, this event, to talk about air quality and especially to talk about the review of the European regulation, the directives of the air quality. And a special thank to Jutta Paulus and Kokalis, who are there, members from the European Parliament, that they are following up really closely this dossier. Thank you very much, the people who are representing the civil society and experts here. For us, it's extremely important that we hear your voice, and your voice is present in the policy making and how we do and deal with this legislation. And also thank you very much to the Commission, to Francois, and to the Swedish presidency, who are there, and they will want also to take the floor. And for us, it's extremely important they are present and we have this interaction with the Parliament. We really appreciate a lot your work on this field, and we appreciate a lot the good dialogue that we have with the Parliament. Well, what we are doing here, this is an event, but usually when we have legislation, we have an official hearing in the committee. It was difficult for the timing to do an official hearing in the committee, and we thought that it made sense that we find a space to talk between members, policymakers, civil society, council, commission, and we talk about this process, that it will be one of the big dossiers that we will have here in the Parliament regarding health, environmental challenges, inequalities, and even economic challenges. I will say we are talking here about air quality, and the reason is this is because it's the main and the biggest environmental threat to human health. And for this reason, after 15, 20 years, we have now we have the third generation of directives of regulation, and now we have a new proposal from the Commission to review our legislation. This is a debate about our health, obviously. It's a debate about the science and what the science is telling us, and especially the advances, the new guidelines from the World Health Organization, the new acknowledge that we have what kind of impact air quality and pollution have for our health. Also because we are extremely worried about the vulnerable people and how inequalities it's a debate in this challenge. Well, we usually think that all we breathe the same air, but it's not like that, basically. And we know the low-income households are usually breathing worse air, and then has this a huge impact in terms of health. We know also that now, according with the current standards, in 2020, air pollution levels in many cities exceed to the World Health Organization. 96% of the EU urban population was exposed to fine particulate matter, concentrations above the World Health Organization guidelines, 95% in the case of ozono, and 89% to nitrogen dioxide. This is only some figures that we have when we talk about this challenge. Well, we have the proposal of the Commission, extremely timely, as a part of the zero pollution strategy. No, obviously, it's timely that we have this discussion. We recognize a lot the effort done by the Commission in launching this process and this proposal. I think as a rapporteur of the Parliament that it's a good starting point and it's a proposal in the right direction. Obviously, also I think the Parliament has a role to play and we have room to improve the proposal. Some of the new areas that I'm sure that François will explain about the regulation is the creation of monitoring super cities, new provisions on access to justice and compensation that are important, merging of the two directives, or introduction of a regular review of the mechanism. These are some of the new elements that we see and we underline that are good elements in the proposal of the Commission. Now, I made the first proposal. We have to build a majority here in the Parliament and do our negotiations, our work. But I will say a couple of things. First, that we made an implementation report. Also, the members present, they know really well. Implementation report here during this mandate. And also, we have a view about what we expect in the Parliament about the new legislation. Basically, the message done by the Parliament in the past, and I'm sure that we will do it again, is like we have room for improvement and we need a strong and ambitious positions. What we approved in the Parliament in this implementation report, and it's my proposal, we will have the discussion here. It's a full alignment with the EU limit values, with the 2021 World Health Organization Air Quality Guidelines by 2030. This will be part of the discussions, but this is an important political message that I think the Parliament could send. Also talk about health inequalities, and then it's talk about monitoring, obviously, guaranteeing equal protection for all, measured in the appropriate locations, improve and clarify our monitoring sites. Also, we have the discussion about the air quality plans, and it's important because also it's a discussion on how we can be Brussels and the EU supportive to local governments and the member states in this process. We have different nature of quality plans, giving more importance to the preparatory air quality plans. This is the first proposal, and we think that with the legislation in the Annex 8, we could do an exhaustive list of relevant air pollution abatement measures, like policies, no? A list of policies that governments could do to work in the right direction to achieve the standards, respecting the subsidiarity, obviously, but showing the path to the right direction, and also some elements of public information. Also, a really important point about this event is, unfortunately, our colleague from TRAN could not join this event. Vera Tax, who is the rapporteur of the opinion in TRAN, she is ill at home, but she is following her and her team this event to also to work after in the opinion in TRAN. But she will want to pass some message that she's taking into account. She's taking into account in this process with the opinion of TRAN. Main sources of air pollution. One of the main sources of air pollution are transport sector. This is something that we know, and then this plays an important role in this legislation. Shifting to zero emissions technologies, vehicles and fuels, especially in urban areas and ports, it's a key process to achieve cleaner air. We have to green our transport sector, straighten transport-related measures, transport-related elements and information included in the member states of air quality plans. It's one of the things that we will want to propose. Report on all air pollution abatement measures, especially from road, maritime and air transport, and also provide information on all measures reducing air pollution in hotspots, especially ports. This is some of the elements that the Tax, the reporter in France, take into account for the opinion. Well, I will want to close, but I will want to pass a couple of messages. First of all, I think one of the challenges in this process is timing. One of the main challenges, because the mandate will end 2024. This is something that we know already, and it will be extremely important if we end this mandate. I'm sure that the Swedish presidency will do their work. We in the Parliament, we will want during this summer to approve our mandate, but after we will have the trialogue and the negotiations. Why it's important that we end this during this mandate? Because one of the best message that the European institutions, the Commission, the Parliament, even the member states that we will send in the next elections, take into account that during this mandate, we had the worst health crisis in 1 century, is that we are dealing with one of the main threats to public health, that is pollution. It's a good message to send. Like a Europe that is protecting, a Europe that is useful. And this is one of the messages that we should to take into account. I know that it's not easy. Probably we will have different positions in the negotiations. Member states, they are plural. We are plural here in the Parliament. The Commission will be demanding with their proposal, but achieve results and deliver on one of the main threats on health. It's one of the most positive messages that we could send as Europe, Brussels, European institutions. And for do that, it's extremely important that the next months, all the institutions here in the Parliament and in the Commission, we advanced. To avoid the temptation in the last minute that, well, maybe it's better if we wait the next Parliament, we will see what will happen with the composition of the next Parliament, and so on. And for this reason, it's important that the Swedish presidency, the Spanish presidency, and during the Belgian presidency, we use our time and we deliver. And then we are going to start. We have a lot of guests today. First of all, for the presentation of the proposal first of all, for the presentation of the 2021 World Health Organization Air Quality Guidelines, we have Maria Neira from the World Health Organization. It will be online. We appreciate a lot, Maria, that you are here and you accompany us in this event. You have the floor.
Thank you very much, and it's WHO, thank you for having this opportunity to talk about such a critical issue. I think you mentioned it very well in your presentation that time is now one of the key words that we need to use. I think everybody knows by now what are the new recommended standards by the World Health Organization regarding air quality. We have 6 major key pollutants that are affecting our health, and I like very much the positive message behind that. What is the positive message? Well, if we as European citizens, if we implement the standards recommended in the new air quality guidelines of WHO, we could save as much as 80% of the deaths which are now related to exposure to only one of the pollutants, PM2.5. I think this is already a very, very strong argument. If we are doing these air quality guidelines, I'm sure you have no doubt about that, is because the air pollutants are affecting dramatically our health. Let me use another word that is extremely important: stroke, obstructive chronic pulmonary diseases, lung cancer, cardiovascular diseases. For how long we will be accepting that our population will be exposed to those terrible diseases that are causing death, and they are causing as well a big, long problem associated with chronic diseases. Chronic diseases that are not only causing suffering to the citizens affected by those diseases, but they represent as well an incredible cost for our health system. Those diseases represent hospitalization for a long time, require a lot of assistance, and therefore, if you need to use the economic argument, is there, we can provide you very good data. So our message is, if you can implement on a very ambitious and quick way the recommended standards in terms of air quality of WHO, even endorsing the interim targets that have been very well defined for those 6 key pollutants, the benefits on the health of the people will be almost immediate. The benefits in terms of reducing health costs will be almost immediate, and those resources could be allocated to other things. And then, of course, no doubt that there will be benefits related to an economic development, sustainability, climate change. We will mitigate the causes of climate change as well. So we are very much supporting the idea of the positive message behind the endorsement of our air quality guidelines. As you know, the 6 key pollutants, I don't need to repeat you, but PM2.5, PM10, of course, ozone and dioxide, nitrogen, dioxide, sulfur, and CO. All of those pollutants are the result of the way we live, particularly on our cities, the sources of energy we are using, the mode of transport and commuting we are using every day, and the fact that maybe we don't have enough energy efficient and our buildings could move into something more sustainable. All of those processes, among the ones that are responsible for the sources of pollution, can be addressed, and as I say, the benefits, the quantification of the health benefits is something that maybe will be useful at the Parliament to convince policymakers on the urgency of taking these measures and how beneficial will be for the health of the people. Clearly, after COVID, we all learned that we need to invest on primary prevention and changing the way we use energy, we pollute in our cities, reducing the pollution caused by the combustion of fossil fuels will reduce the causes of climate change and will generate enormous benefits for all of us. We will help you to quantify those health benefits, which we think could be the best motivation for our citizens to feel well represented for an organization and institution like yours, and proving that we are protecting the health of our citizens and creating better environments for them to develop. Over. I don't want to take more time. Happy to respond to any question if you want, and I can address, of course.
Thank you very much, Doctor. Maria, it's a pleasure that you are here. We will continue with the presentations. It will be 3-4 minutes per person, and then we will have a round of questions and comments. Now it's time to Francois Wagenhout, who is representing the Commission here, and is the person in charge of this proposal.
Thank you very much, Javi, and thank you again for the initiative of the discussion today. I think it's very timely, and it's a pleasure to be with you this afternoon. And it's always good to meet Maria, even online, as we discuss those issues regularly as well, with the WHO, of course. You've sketched the scene very, very clearly earlier in terms of the health, the economic, and the environmental case for action. So I don't think that I need to dwell extensively on this. You mentioned the premature death numbers, which of course are only one illustration of the health challenge, as we're looking at many other dimensions, which Zorana, I'm sure, will cover later on. When it comes to the economic costs, I think it's always useful to put them to the fore. The annual costs of air pollution are staggering if we look at them purely in economic terms, and of course that is not the only dimension that we're looking at, far from it, in being around the range of 230 to 853 billion euros. So this is really something that is annually unacceptable as a cost, and something that we need to act upon, and that certainly was at the core also of what we've proposed on the way forward. So if I sketch quite quickly what the proposal we've put forward does, and I would also use the opportunity, of course, to commend you, Javi, for all the work that has been done in the Parliament, not just in terms of producing very speedily the report that is before us, but also for all the thought that has gone into it and all the rationale that underpins it. This is something that we very much welcome and will really enrich the debates. And I could not agree more with you about the fact that we need to finalize this during this mandate, and the Commission is certainly determined to do its utmost to support the Parliament and the Council in order to meet that deadline, so that we can have new legislation in place before the Parliament and the mandature ends. On the proposal itself, 4 key clusters are covered. The first one is environment and health outcomes, and there our directive sets out a zero pollution objective for 2050 that includes very clear and precise intermediate targets. And those standards for 12 air pollutants that we cover are to be attained by 2030. These do not fully align with the WHO guidelines, so that is a difference with what you've proposed, but they do meet the ambitious end of the range of interim targets the WHO has put forward. And through the zero pollution objective that we've set out, we also establish a course of action that will actually be kept under regular review and keep us, through taking into account societal, economic, technological developments, keep us on course in order to be put on a trajectory that ensures that we do get to such levels and to the levels as recommended by science as we go along in the implementation phase. Second element that we introduce is on governance and enforcement. The proposal refers in particular to air quality plans, which we want to be made more effective in ending and preventing exceedances of EU standards. So for the first time, our air quality plans will need to be put in place before standards enter into force, if this is needed to prevent an exceedance when the standards become binding. So this is a novelty that we believe is going to reinforce considerably our end in trying to achieve results. We also improve enforceability with new provisions on access to justice, on compensation, and on penalties. And those, again, are trying out to capture in legislation, certainly with penalties and compensation, novel thinking when it comes to air quality, whereas on access to justice, we've had a directive that has been extremely actionable so far with the infringements. We've demonstrated that, of course, at EU level, but before that, at the local, regional, and national level, there's been a lot of litigation that has been enacted, and that is, I think, to the credit of the text as it stands, but we want this to be made even more explicit and to make it also more spread in the EU, so that in all member states that possibility is indeed not just given, but acted upon. Third cluster, monitoring and assessment. We already have a very comprehensive network of air quality monitoring stations in place. And thanks to it, we've had extremely useful information that has helped us to underpin action and prioritize the focus of such action. This is something to be proud of and that our member states have worked on extensively over the past decades. But we also have found that there's a lot of room that remains to simplify and improve the rules for monitoring, to measure also lower levels of pollutant concentrations, and to use air quality modeling a lot more. There's obviously a lot more that we can do on modeling than we could back in 2008 when we last revised our legislation. So this is something that we want to reinforce in the current proposal. And importantly, for the very first time, we also set rules for monitoring air pollutants of emerging concern, as we call them. So ultrafine particles, black carbon and ammonia in particular. And this will help us to better understand the effects of those pollutants, as well as guide further considerations as part of review mechanisms as to what further action could perhaps be envisaged. So this is another novel element that I would like to highlight. Lastly, fourth cluster on information and communication. In the 2022 Eurobarometer that we carried out on air quality, respondents reminded us once more that they want more information on air quality. So this is something that we need to continue to deliver upon. I think that there's a lot that has been done so far, both at EU and at national and lower levels of governance, but we need to expand this. So to do so, we'll expand up-to-date air quality information, we'll include requirements for air quality indices to provide hourly reporting of available air quality data, and this is what we've proposed to the co-legislator. This, in our view, will include also an empowerment of citizens that goes with it, which we need to work upon. And we will, in doing so, also provide, if our proposal is taken forward, more information on the possible health impacts, which we think is, again, at the core of the usefulness of our legislative framework. I'll finish by saying that our impact assessment and all the underpinning that went into the proposal, starting in 2017, when we reviewed the legislation, in 2019, when we started to develop the new one, gives us confidence that this will result in significant positive impacts, be they health-related, environment-related, economy-related, and of course, socially related, because this is a social fairness issue, as you so aptly put it, Javi. So when fully implemented, we will, if our proposal is, of course, going ahead, contribute to a reduction of premature death due to levels above the WHO by more than 75%, as things stand in what we've proposed. This will come at a price, and that cost is a bit below 6 billion per year. We're talking about 5.7 billion, which is obviously a cost that cannot be neglected in terms of its impacts on our economies and societies at a difficult time. But at the same time, we need to relate it to the gross annual benefits that we will have, and those would be from the conservative range around 42 to the more positive range 121 billion. So this in itself, I think, speaks for the balance of what has been proposed and the case that we can make for it. One very last point, because you alluded to Veratax's very good work on the transport side, which we would also want to commend on the occasion of the meeting today, because it was as well speedy and extremely to the point, to say that the source legislation dimension also remains essential here. And transport is one of the relevant sectors, and we're pleased about the interface that has been established through their opinion, but at the same time, we need to go beyond transport in terms of also making progress in all relevant sectors that have a bearing, and this House is the best House to achieve those objectives across such sectors so that we deliver for clean air and the health of our citizens. Thank you very much.
Thank you very much, Francois. Now it's time to Jacob Hagberg, who is representing here the Council, the Swedish presidency. Thank you very much.
Thank you very much. And first of all, thank you for inviting me here. My name is Jacob Hagberg. I work at the Swedish Permanent Representation here in Brussels, and I'm chairing the zero pollution package files in the Working Party for Environment in the Council, and including this file. What's happened so far is that we had the file presented in November, and after that we've had one meeting on the file in the Working Party. We have the next meeting on Thursday, actually. So we haven't gotten very far in the Council yet. We've started the read-through and the discussions on the articles. As such, we have a number of meetings planned for the Swedish presidency. So we count on being able to move forward quite substantially on this file. It's unlikely we will come to a general approach, but we will have some concrete results to hand over to the Spanish presidency when they take over, to hopefully be able to conclude on the file. Their priorities I don't know yet, though. You have continuous discussions with them on making sure that they can take over the file as smoothly as possible. And as you alluded to before, time is of the essence here, so we're all trying to push as quickly as we can. So I think that's all I can say for the moment from the council on what we are doing. Thank you.
Well, thank you very much. Now it's time to civil society and to the experts and science. That it's one of the main, probably the most important part here when we are talking about legislation. It's time to air pollution impact on health by the Professor Sogana Andersen from the European Respiratory Society.
Thank you very much, Javi. Thank you for inviting me today to talk about air pollution impact on health. And I'll walk you through some of the main points and why this is so important, why air pollution is really for us something of pandemic proportions and has such a widespread impact on our health, public health in Europe. I'll start with lungs, since I represent European Respiratory Society. And as Maria has mentioned, we know that air pollution increases number of major chronic diseases in healthy individuals. It impairs our lung function and leads to increased risk of asthma, chronic obstructive pulmonary disease, lung cancers, as well as respiratory infections such as pneumonia. And lately, we also see really convincing impact of COVID-19, which is of great concern. To summarize this in some numbers, we know now that globally 40% of COPD deaths and 30% of lower respiratory infection deaths are due to air pollution. These are really big numbers. 19% of lung cancer as well. 16% of asthma cases in children are due to air pollution. So they are really impactful numbers and possibilities for prevention. I also want to point out for respiratory patients, especially the short-term impact in daily life, especially respiratory patients are bothered by air pollution. It causes them to have serious symptoms from shortness of breath, need to use medication, wheezing, to serious ones such as need for hospitalizations, emergency room visits, sick days, and even air pollution on short-term basis can trigger death. This is not just deaths in elderly people that are already sick and fragile. These are deaths in children. And I just want to remind you of the tragic case of a 6-year-old girl who died from a fatal a severe asthma attack in London. So it became our face of seriousness of air pollution impacts even here in Europe. From lung, I want to go to heart and cardiovascular diseases are #1 killer in Europe and globally. And we know now that 20% of cardiovascular diseases are due to air pollution, 26% of strokes. So this is really, again, translated to a huge number of major burden of cardiovascular disease, as well as diabetes. This is fairly new, but we know now that 20% of diabetes-related deaths are also due to air pollution. Cancer is another big topic in EU Commission, and Europe Beating Cancer Plan is aware of that and recognizes the huge impact on European population. This is #2 cause of death. We know that 19% of lung cancers are related to air pollution, but EA recent report pointed out that probably 10%, probably even more, of all cancers are likely due to air pollution. We lack research in other cancer types, but we're slowly seeing more and more studies. So there's also huge prevention possibilities in dealing with cancer, with dealing with air pollution. Emerging area of concern for us is air pollution impact on brain. Besides stroke, we see really concerning results of air pollution impacting our brain in children. We see increasing number of studies that air pollution impairs our cognitive development in children, their IQ, their ability to perform, perhaps also impacts their risk of ADHD in autism. We also increasing number of studies on dementia and cognitive decline in elderly, and most recent studies show significant impacts on mental health throughout lifetime in children, young adults, and elderly adults as well. So just to summarize these huge impacts, not everybody is equally affected, and we have to take certain care in very susceptible groups. These are pregnant women, unborn children, young children, elderly, and those that are most poor and most unlikely to be able to protect themselves from air pollution, both in rich countries, but also focus on Eastern European countries and areas where air pollution is extremely high. And I just want to wrap up with, just to summarize what impacts the new WHO guidelines have for us, some disturbing findings from here to restate. As it was mentioned earlier, everybody is exposed. We have health risk factor that everybody is exposed to. 97% of European population is exposed to these harmful effects, and there are no lower threshold below which air pollution is safe. This is the main points of WHO report. Health burden is huge. If we count in deaths that we've seen in USDA reports, 238 premature deaths, at levels above PM 2.5 and 50,000 additional for NO2 above 10, and not to mention again things we don't count, millions of hospital admissions, sick days, and so on from all of these diseases I mentioned that we don't count yet in these kind of reports. And my final point is that even this is underestimation of real effects. The WHO guideline-based calculation of 238 premature deaths is underestimated, as since last few years, since the WHO report came, we've seen a number of high-quality European studies, a lab study that showed us that health effects on mortality and other health outcomes in EU are even stronger than this. So this number of deaths is bigger than what we currently know. And that there's a likely curvilinear association, meaning that exposures in low end are even more dangerous, and this is not reflected in current calculations. So to summarize, here in ERS and joint health community, we are fully, based on our science, on our evidence on health effects, fully endorse full alignment of new air quality directive with WHO guidelines. We accept no less in the name of health, and we know that this is a major public health and planetary health opportunity that would prevent substantial number of non-communicable diseases, that would make EU citizens more resilient also to infectious diseases such as COVID-19 and similar pandemics that we also have to be prepared for, improve life of our lung, heart, and other chronic disease patients, and of course, just to mention co-benefits on our health indirectly through improvements in climate change mitigation that would be achieved with these effects. So we go in that no one should get sick or die from breathing in EU, and I hope this legislation will follow. Thank you.
Excellent. Thank you very much. And now for talk about the air pollution impact on ecosystems, we have Margarita Toloto from the European Environmental Bureau.
Thank you for the invitation, and good afternoon, everybody. I'm really happy to be able to share with you some highlights on why it's important to tackle air pollution, also to protect our environment and ecosystems. To go back to what François was also saying about air pollution numbers in terms of economic impact, I would like to highlight that 4 to 12 billion of euros are caused by air pollution damage on ecosystems. It costs 10 to 11 billion in crop yield loss and also 19 billion in forest damage. And we can safely say that these are usually conservative numbers, so we can assume that the costs that ecosystems are burdening are much higher. I would like to flag that this AAQD recast process is happening in the framework of the Zero Pollution Action Plan, an overall commitment by the Commission to achieve a zero pollution Europe by 2050. And within the Zero Pollution Action Plan, there is a target by 2030 to cut the share of ecosystem impacted by air pollution by 25%. In 2020, this number, we only achieved a cut of 12%, meaning that we still have to deliver a lot in terms of making the Zero Pollution Action Plan objectives reality. When we speak about ecosystem impacts by air pollution, we mainly refer to ammonia and ozone. Ammonia is mainly emitted by agriculture in Europe, more than 90%. And here, again, I go back to what François was saying on the importance of making sure that there is action also at the source, specifically on agriculture, which is a sector which is lagging quite behind within the air quality objectives delivery. Ammonia has a direct impact on ecosystem, causing eutrophication and acidification, and it also generates PM 2.5, which is the most harmful, one of the most harmful air pollutants in Europe, and which is causing a lot of health damage, as it has been highlighted by Zorana just now. We also think it's important to promote, also through the AAQD revision process, tougher action to reduce ozone concentration, also by tackling ozone precursors, including methane, and again, agriculture being the main emitting sector in Europe, responsible for around 54% of emissions. Ground level ozone damages vegetation, crop yields, so there is no reason why it shouldn't be tackled further, and also with the help of all sectors concerned. I would like to put the AAQD recast process in a more general framework, saying that this is not the only instrument which will help us in deliver on ecosystem protection. There is a full bunch of relevant legislative processes ongoing at the moment, and the same commitment regarding an ambitious AAQD should also be shown and highlighted in the other ongoing processes, like the revision of the Industrial Emissions Directive, the implementation of the national CAP strategic plans, and especially the revision of the national pollution control programs under the NEC directive, which are also dealing with reducing ammonia emission overall per each member state. So I really thank MEP Lopez for the great draft report he put forward, and we are really here to help and support any step taken to reduce air pollution, also to protect the system. Thanks a lot.
Well, thank you very much, Margarita. Now it's time to talk about enforcement of the air quality directives, and especially access to justice and compensation. And to do that, we have Hugo Tadei from Clean Earth.
Thanks, Javi. Yes, enforcement is fundamental. I mean, we can have very good air quality standards, but then if policies are not implemented, how can we protect the health of people? So we believe that focusing on improving air quality plans, access to justice, compensations, and sanctions are a fundamental part of this directive. As Clean Earth, in the last 15 years, we have been working across Europe in more than 12 countries, helping citizens and NGOs to claim the right to clean air and make sure that policies are implemented in more than 80 litigation cases. And we have developed a lot of expertise on what worked under the current directive and what actually needs to be improved to ensure full implementation. We know that implementation has been one of the biggest struggles of the existing directive. So I would like to flag a few points that we believe are essential. The first point is air quality plans. Air quality plans are the cornerstone of the air quality directive. They are the way that air quality standards are brought into life. They are the way that authorities implement policies and measures to fight pollution. So it is essential to make sure that the legal framework is as clear as possible and as strong as possible to support authorities to take action as early as possible and fight breaches before they happen. So first of all, we welcome the proposal of the Commission and the suggested improvement by Javi López in having preparatory air quality plans. And these plans need to be implemented on day one as soon as the new directive is adopted, because that will leave enough time for authorities to put in place policies. And it will provide the tools to cities and regions to demand central government to help them to fight air pollution. So that's essential, and we fully support it. The second point is air quality plans after the breach of 2030 limit values. Here, there needs to be a clear change in step and efforts by competent authorities. We've seen so many times authorities in the past approaching air quality plans as just a routine air quality management document and just adopting plans, setting a deadline for 3 years and then missing the deadline and then updating the plan and so on forever. There needs to be a clear difference between what happens before the deadline and after. And that means that air quality plans need to have a shorter time frame than what is possible before. And there needs to be clear consequences when the air quality plans fails to achieve compliance in the shortest time possible. And that means clear sanctions for competent authorities if they do not do it, because that's, we know, one of the most effective incentives for acting. And then there needs also to be help authorities to select the best policies. And that's, in our view, what the current proposal and the suggestions from Javi López will do in Annex 8, suggesting a list of policies that are effective and requiring authorities to consider them when preparing air quality plans and explaining if they're not putting them in place. And the other essential part is then to make sure that there is access to justice, compensation, and sanctions. These are the provisions to make sure that everyone can breathe clean air and can see their right to breathe clean air respected. As Francois said, there is already a lot of case law on access to justice, but unfortunately, a lot of member states, like in Poland, Bulgaria, and Hungary, systemically deny access to justice to citizens. So if we really want to ensure that everyone enjoys the right to clean air, we need to have an explicit access to justice provision. And that's not only to help people everywhere in Europe, but it's also to ensure cleaner air also in countries where access to justice is respected, because air pollution knows no borders. So if you're taking action in your country, but in the bordering country, no action is taken, then your people will still be exposed to high levels of pollution. We know that we need action from everyone. We need also clear provisions on compensation. We have heard about the scientific aspects of how air pollution is harming people. And the reality is that up until today, no one has been able to obtain compensation for the damages suffered. And usually it is the most vulnerable and sensitive groups that suffer the impacts of air pollution. So we need an explicit provision, and we need some rules to help people to obtain compensation. The science is very complex. Having access to information about what are the air pollution levels, what are the epidemiological data, what is the health effects, is extremely complex, and we cannot expect that every single citizen, especially people from vulnerable groups, will have access to all the technical expertise to overcome this burden. So once enough evidence is provided by the claimant, we believe that it's fair to even the dispute and pass the burden on who is breaching the law to prove that actually air pollution has not been contributing to this damage to the people. And finally, on sanctions, I've already mentioned this. It is an essential part of the directive. We're now in 2023, 15 years after the previous directive, and there are still a majority of member states all across Europe still exceeding the existing directive, and there hasn't been any sanctions for those failures. We know that when there are sanctions, there is a much stronger incentive to actually take action before breaching the law. So that's an essential part that we fully support. Thank you very much.
Thank you very much, Ugo. Now we are going to talk about the transport policies in urban areas and its impact on air quality. And we will have for us for this Mark Nieuwenhuizen from ES Global. I suppose it was a little bit wrong, but
I was perfect. Thank you so much.
Thanks.
Many thanks for letting me speak, and it's great to be here. Unfortunately, I couldn't come to Brussels today, but we've heard a very important information already before, and I would like to emphasize some of the information what we've heard and what we also could do. As we've heard before, I mean, cities are actually hotspots of air pollution. That's where we see lots of our problems at the moment. And, you know, recently we showed that there are more than 200,000 premature deaths in European cities each year. So that's important to keep that in mind. In the original cost-benefit analysis for the new guideline document, there was a lot of emphasis on technological solutions and what was within the competence of the Commission, I think. But there is much more than that that actually could be done to lower air pollutions, and that's, I think, important, you know, to take that further. I mean, what we've just heard, also the air quality plans. I mean, they were a good step forward. What to do. And I would like to go a little bit into that. For the sake of time, I'll focus on the transport sector. So as what I said, I mean, there's a lot of emphasis on technological solutions, but they're often quite slow. I mean, and also what we should be looking at is also more behavioral or urban planning solutions that should be included and be worked out more, because they've been shown to be effective, and also they could be implemented faster to some extent. So what we've seen in many cities, they've introduced the low emission zones. Unfortunately, sometimes or often too small. I mean, I think we need to go for lots, much larger areas, and also stricter criteria for the low emission zones, but we know that they're effective. Furthermore, also, we need to look at a shift away from private car use in cities particular to more public and active transportation, such as walking and cycling, because this is very important, but also to realize this needs also much more infrastructure, I mean, in particular for cycling. Also, we should look at more new urban models, or I would say new urban innovations, particular, such as the 50-minute city that has been introduced in Paris, and many cities are following. The Barcelona superblocks that are being implemented to some extent at the moment, and where we see, for example, a 25% reduction in air pollution. Or the London low traffic neighborhoods, where we also see reductions in air pollution. And also things like car-free neighborhoods, what we know are existing, like in Vauban, in Freiburg. These are all very good new innovations that are being introduced in our cities and should be spread around other cities as well, because we know they can contribute to this. Furthermore, I would like to emphasize the needs for low traffic or no traffic school environments. Unfortunately, our children are seriously affected, as what we've heard before, and we need to make sure that they're not exposed during the day on a continuous basis to high air pollution levels, what we often actually see. I would like to emphasize that these measures, what I just mentioned, don't only benefit health through the reduction of air pollution, but also through noise reduction. Noise is also an important determinant of health. Also, it allows to introduce more green space, and also they reduce to lower the urban heat island effects. We know that urban heat island effects are becoming more and more important because of the overall warming, and in particular their cities are affected for it. And finally, also they improve health through increase in physical activity. A large proportion of our population don't have enough physical activity, partly because they can't, there are no opportunities, and we need to provide them with opportunities, for example, with these new urban models that where physical activity is extremely important. As what I said, I mean, there's a certain urgency to this as well. We can't wait. I mean, even 2030 is quite a long time away, and we get still many deaths, many cases of disease. And for example, you know, I see there is a lot of emphasis, for example, on the electric car, low emission cars. But to have the full turnover, I mean, it takes about 20 years before we have a whole turnover of the vehicle fleet. And that's a long way, to be honest. I mean, and so we should be looking at quicker measures, what I just mentioned as well. Furthermore, these measures also address the climate crisis, what I said, also make cities much more livable and also equitable. Partly equitable because of you know, lowering the air pollution levels that normally affect the poorer population more, but also through providing more accessibility to transport. Don't forget that many people don't have a car, for example, or can't drive, but still need to get somewhere. And we need to improve accessibility so people can have jobs, you know, can go to destinations they would like to have. And therefore, you know, providing public transport or also making cities of proximity, like the 50-minute city, is extremely important as well. Of course, many of these measures are without the direct competence of the EU, but within the city competence. And I know, I'm living in Barcelona, a city with high air pollution levels where elections are coming up. It's important that our policymakers, our mayors have targets, ambitious targets for air quality, that they can introduce these measures, and that it is shown that it's very important to have these ambitious measures. And therefore, I think, I strongly believe that we need to follow the current WHO air quality guidelines, because they're ambitious, but I think they're also feasible, particularly if you introduce many different measures. Certainly we know that there is no magic bullets for anything, so we also need to look at introducing many different measures at the same time, and only then I think we can achieve a very good air quality, what is actually very good for all of us. Now, the good news, I think, is that already quite a few cities are working on these things. They are very progressive, they're innovative, and we need to make sure that other cities are actually following these examples as well, so that we can have a clean environment for all of us. Thank you.
Thank you very much, Mark. Well, I think we made all our presentations. I think it was clear that we are facing a slow motion pandemic, no? And this is the size of the challenge that we have to face. We saw during the last years what we are able to do to protect health, and now it's time also that we are proportionate with the threat that we are facing. We were talking about enforcement, the proposal, the council work, health, ecosystems, and enforcement, and access to justice, and also policies, no? Because we talk here about the standards, but then after, this has to be translated to real policies and change of patterns of transport and change of models of our cities, no? And it's important that we talk about this also. Now we will do a round of questions, suggestions, comments. I don't know your names, but we will be able to do it. If you raise your hand, okay. We can 1, 2, 3. Okay, please.
Hello, my name is Ronald Leffler, APA from MEP Silvia Limmer. Thank you for the presentations. I have the following question to the panel. Luckily, we don't start at point zero because in Europe, the air quality has improved the last decades sustainably. For instance, when I think about Germany, where I come from, in the 1970s, in the 1980s, you had a lot of air pollution, a lot of smog alarms. You had soot particles all over in the air, especially in the industrial regions. And so thanks to catalyzers in cars, thanks to filters in coal plants and other measures, air quality already has improved very much. And also in the last decades, luckily, life expectancy in Europe has been increased. So my question to the panel, be it WHO, be it Commissioner, be it NGOs, do you also assess these improvements, let's say these success stories so far, and if yes, by which methodology? Yeah, thank you.
Okay, thank you. Very good question. Second.
Thank you very much. Tomalim from Eurocities. So we are the voice of the largest European cities in Europe. Felt the need to intervene because we talked a lot about, indeed, about cities and the situation in cities related to air pollution. So, well, indeed, this directive is very, very important for our members. As you said, there are many cities in Europe still face systemic problems of air pollution, and the standards, the framework in general that is adopted at the EU level is very important because these drive their actions. Of course, they need the right rules to be accompanied. We talked about low emission zones. Indeed, that's a tool that is more and more used by many cities in Europe, and now not only in Western and Northern Europe, but we also see cities like Warsaw, Riga, Sofia considering low emission zones. So in a way, I would say that in the discussion on the Ambient Air Quality Directive, the targets the governance framework is as important as the targets, because without the right tools, without the right accompanying measures, cities will do their best, but of course they cannot solve anything related to air pollution. That's why, in our point of view, we also need to tackle the sources of air pollution. We mentioned agriculture. Road transport is also a big source of pollution in cities. So we need to make sure that we have a consistent framework at the EU level, and that's why we would like also to see in this directive like some links with the other legislation to make sure that they all go in the same direction. And there are also indeed positive steps that Mr. Lopez, you proposed in your draft report. I mean, the fact that we need to have preparatory air quality plans. This is very good because in some cases we've seen that local authorities tend to wait until the very last moment to implement air quality plans when they're facing the wall, basically. So this is a very good step, and we hope this will end up in the final text. Thank you very much.
Thank you. I work for the Secretariat of the European Committee of the Regions, and I wanted to inform you that this topic, being of great local and regional importance, is also object of a legislative opinion that the Committee of the Region is preparing. The draft opinion will be ready in a few weeks. And this is also connected with the work that the committee is doing together with the European Commission in the Zero Pollution Stakeholder Platform, and integrating more widely in the Green Deal Going Local working group the committee has established to connect Green Deal policies across policy areas. Thank you.
Thank you very much. Please.
Hello, thank you very much. My name is Ebba Malmqvist and I'm from the Pollution and Climate Secretariat, AirClim. I just want to highlight that yes, it is important that we have reduced air pollution in Europe, but there is still a lot to do, and the evidence is increasing. We are seeing more and more evidence on morbidity, and we are seeing impacts on children and pregnant women and throughout the life course. So we need to do more, and we very much welcome this more ambitious proposal. Thank you.
Okay, we have more. Then we close the... Okay, we close the comments and questions, and then we will do a last round with all our guests of 1-2 minutes per person. First of all, it will be Maria, please.
Gracias, Javier. Thank you. Definitely, I like it very much, the latest statement on saying we need to do more. I cannot agree more with that. We need to do more. The scientific evidence is really growing on an exponential way, and as well as the interventions that we know that are useful to reduce air pollution. So we will not get into details into that, but we have a big collection of experiences that prove what it works on a very short time as well. I agree with Mark that we cannot wait for 20 years now to see some results. We need to start with some interventions that we know that they work already and we have plenty of benefits. Regarding the first question by the, German gentleman, I didn't get the name, learning from experience. Yes, it's true. WHO is monitoring that. We have even very good data proving that one of the regions that have improved the better, I mean, that reduce air pollution on a more substantial way has been the European region and North America. Definitely, that is true. We have advanced a lot and we have good data proving it. But unfortunately, we still have 400,000 deaths every year in the European at large region as classified by WHO of deaths caused by exposure to air pollution. So we are learning from the past. I think everybody will remember probably the great smog in London in 1952. That was a result of an industrial pollution, but as well weather conditions. But as a result of that, 4 years later, the UK Parliament approved the Clean Air Act. That was something historical. And I think we are now at an historical moment as well if we want to reduce not only those terrible deaths, but as well the diseases, the loss of quality of life of our citizens at the cost of the health system that we are having every year by endorsing the air quality guidelines, which is feasible. I agree with that important word. It's feasible. It can be achieved. It will require only some ambition from a political point of view, good data to convince our citizens of the benefits for the health that this will generate, and learning from each other on the interventions that have been well documented and we can put in place. All of these three things are there, learning from the past, but still a lot of things to do, and to do it on a very short time. Thank you.
Excellent, Maria Doctor. It's really a pleasure that you are here with us today. And then I will give the floor to Francois.
Thank you very much, Javi, and thank you very much to the colleagues who put questions to us. So on the first question, a very important question indeed about whether we look at the improvements that have been materializing over the past decades? And the answer to this is a resounding yes, we do. And our impact assessment work is very solidly underpinned precisely because we not only look at what scenarios we can envisage in terms of progress to be made, but we also obviously base all that on the solid experience that we tackled through the overall review of our policies. And I think there are two messages to convey here that certainly converge with some of the points that you've made. One, our policies, and when I say our policies is our legislation, but also the way in which member states and subnational entities have also worked to improve clean air, have delivered in part. And that was the conclusion that we had concluded precisely in our evaluation back in 2019. And if we look at the translation of this in terms of the evolution over the past 20 years, you're right, the situation has improved and we've documented this. And this is a starting point that we need to consider in looking ahead. If we look at the emission levels between 2000 and 2020, so all the emissions of key pollutants that we're looking at in our clean air legislation, we've seen decreases from 13% to 84%, depending on the pollutant that we're looking at. This is very significant. I think 84% is SO2 and 13 must be ammonia. So that gives you an indication of the progress that has been made, and that has been translated into improvements in air quality, which are undeniable, and that we also take as a starting point. We have analyzed that in the impact assessment. We also regularly provide an overview of clean air policy through what we call the Clean Air Outlook reports, the latest of which we presented back in December. And I would invite you, if you haven't yet had a chance to look at those, to go into those documents, because they go precisely into the analysis of the progress that has been made and the progress that we can then consider as still feasible. And that's the last point that I would emphasize in relation to your question, is that we look at feasibility of progress, not just the desirability of it, but the feasibility from a technical viewpoint, from a physical viewpoint, from a socio-economic viewpoint, because we want to anchor our policies in reality, very much along the lines of what you've outlined. When it comes to the Eurocities point, Thomas, well, you alluded to, I think there's a point that I would like to pick from what you mentioned, which is that governance is as important as targets. We certainly would agree with you from the Commission side that if you have ambitious targets, but you have an empty enforcement framework, or if you have very vaguely defined actionability on your legislation, it's actually not going to work. Whether you need to go as far as to spell out the specific measures that need to be taken is one step we haven't made, as far as what you've suggested, for one clear reason, which is also subsidiarity and the way in which in which solutions have to be devised at the level where they make a difference. So we also very much believe that that dimension needs to be protected in the legislative framework. So that's the approach that we've taken. Whether the balance can be discussed further, that's certainly something that we'd be open to discussing more with you, including on whether or not the proposal goes far enough in terms of specifying specific measures. You mentioned low emission zones, but I guess that would be applicable to some other measures that we're considering. And on the Committee of the Regions point, well, just to say that we're very grateful from the Commission side that the Committee of the Regions is producing an opinion. We're very keen to work with the Committee of the Regions because regional, local authorities have an essential role to play in the implementation and the successful delivery of ambient air quality legislation. And the more commitment we get from the Committee of the Regions and the more lessons the Committee of the Regions identifies for us to take into account in the next phase of implementation, the more we welcome it. So thanks very much for that.
Thank you very much, Francois. Then I will give the floor to Jacob.
Thank you very much. Yes, I think I would like to partly echo previous speakers on the contributions from the regions and from all sorts of stakeholders. It's very useful to have all those inputs and ideas when we do these negotiations, of course, and when we try to find ways forward. On the question on the need for a consistent framework and relation to other ongoing negotiations on other directives, that is something that we, at the Swedish presidency at least, are working very hard to try to achieve and make sure that those those proposals are supposed to contribute to this proposal, for example, are really able to deliver that. Of course, we are also in the hands of the member states, so it's also up to all member states on how the specific different proposals are formed in the end. But we definitely try to contribute to make sure that is actually the case. So yeah, thank you.
Thank you very much, Jacob. Sugana.
Thank you. I would like to use my time to answer your very good questions. Of course, we have experienced major reductions in air pollution in Europe. I just want to remind you that our research, especially in the last decade or so, and major investments in research have exactly looked at that question. Despite our improvements, do we still see a health effects at the levels we have today? And all the numbers I presented you is from that research from US, in Europe, where all population studies is living now beyond current EU standards. We see surprisingly large effects, so we managed improvements. They have not done enough. Clearly, we've seen stronger effects, even as a health community have hoped for. So this is disturbing. We see also a lot of research progress evaluate exactly what you talk about, where the reduction of air pollution leads to improvements in health, and we see that. Just the latest study from Stockholm, one of the cities with lowest air pollution in Europe, showed that improvements in air pollution in the last 10 years contributed to measurable improvement in lung functions in children with asthma and without asthma. So that shows us even at cities with lowest air pollution levels, there are things to gain with improved air pollution. And this is a strong argument. There's similar studies from Switzerland in grown-ups and so on. So this is an important question. We have achieved improvements, but clearly not enough. But we use them as a momentum to say we can really fix that. We know how, if we compared, as Maria said, London 56 years ago and now. And remember, there's still way too many cities in Europe, in Poland, in Romania, in Bulgaria, in Northern Italy that have levels as London had some years ago, and a number of episodes, and these particles travel regionally. So there's still a lot to do in the eastern part of Europe, but also here. Thank you.
Thank you very much. Now it's time to Margarita.
Thanks a lot. To answer to the first question, I think the SO2 story we have seen in the past is a clear example about the fact that we can achieve important reduction if the right measures are in place. And this is what we need to do also in this case. We need to make sure that the right measures and the good legislation is in place to reduce equally and at the same extent existing issues that we are experiencing with other pollutants. Our call to make monitoring networks better and to improve the number and to increase the number of monitoring stations also goes in this direction, actually, because if you can monitoring well and properly, you can also detect successes. And this is an important point to keep in mind. So an investment for securing that the efforts made are recognized and visible to the public as well. I do think that still 300,000 per meter deaths, more than 3,000 per meter deaths per year is a high price to pay. And I don't think we can here identify a number which we can consider acceptable. So we should just move forward and continue to reduce air pollution to the maximum extent we can, actually, and trying to improve the legislative framework which will allow us to promote actions that are going in this direction. Regarding the point raised by Eurocities, I totally agree. I think coherence is an important call that we need to make. And actually, member state representatives sitting in the council have the power to ensure that coherence is a main driver when deciding what will be the result in the different decision-making processes that are ongoing and that I also named previously in my contribution. I think the point raised by Ebba is also key. I mean, and again, it's a call to move forward as fast as we can and without thinking about, okay, we have achieved an acceptable number of premature deaths or ecosystem damage and we can live with it. Thanks.
Thank you very much. Hugo?
Thank you, Javi. And yeah, I would like to start with the first question as well, to stress that we're not starting from scratch, not only in terms of air pollution trends and policies that have been working, but also in terms of implementing the previous directive and the governance system. So the Commission has done a very thorough fitness check on the previous directive and a very thorough impact assessment on the proposal, and the results are very clear. Things like access to justice work to ensure stronger and better and more timely action for improving air quality. To give an example, in Germany, we have seen that in the cities where there has been litigation to push authorities to put in place policies, levels of air pollution have been improving twice as faster compared to the other cities where no action has been taken. So the pressure from people, from NGOs, help authorities to prioritize the right policies and protect health. And I think the same for air quality plans. We know a lot about what did work and what did not work in the previous directive. And we know that there needs to be a clearer guidance for cities. And it's great to hear that cities are calling for this help from European law. And I believe that the proposal from Javi López finds a very good balance in suggesting what are the effective policies that needs to be considered in air quality plans, while leaving to the competent authority to select the policy that works best in the local circumstances. So finding a balance with subsidiarity without going too far. And I think the final message is we've heard a lot of good policies from Mark. There is a lot of energy, a lot of experience in the room and also all across Europe. And we are all here fighting together to have a very strong directive that will help us to finally fight pollution.
Thank you very much, Hugo. And then Mark online.
Thank you, Odette. Just to add a little bit to this, is I think we've seen progress over the last 20, 30 years. I mean, and it's very important, but I think we can do more. And Francois mentioned the issue of feasibility. And the question for me, you know, what is feasible? I think a lot of feasible. I mean, look at this, what we did with our biggest health crisis over the last few years, COVID-19. If we all put the effort together, we can get over it fairly quickly. And I think this is a similar case, that if there is the will there, we can do an awful lot. And that's what we're actually looking for. Also from an environmental point of view, in the kind of this particular area, remember that we've been successful with taking lead out of petrol, what was very important. Also, if you think about the indoor smoking ban, I mean, a lot of people were against it, but after it was done, people said, why didn't you do it earlier? And that's many of these kind of things that, you know, as soon as you see the improvements, actually people will say, from why didn't you do this earlier? Why didn't we, why do we have to live in cities with very high air pollution levels? So I think that's very important to learn from what we've done in the past. There was some comment about the governance. I think governance is important. What's at EU, also what is at city level, but also within cities. I think too often what I see is, for example, things become a play ball politically. Let's say, for example, cars, people are for, against cars, but then they lose the argument about, you know, or forget about air pollution and the related disease. And I think we need to make, you know, keep making this connection, that there is a connection with this, that, and that's what I said, you know, there's good evidence for quite a few policies or measures that have been implemented so far. And I think it's also for the air quality plans. I mean, it's a very good initiative, you know, but it would be nice also if the cities actually do a proper assessment of the policies they would introduce in terms of air pollution modeling. We have now many tools where you can actually model what is the impact on air pollution, and then also on health, because I think, you know, taking this measure to from what is the measure to the levels of air pollution to health is very important to convince citizens as well, I think, and also people that are still opposed to some of these things. I would like to warn for one thing, you know, because we're talking about this, and also what we see within air pollution is, for example, if you come to transport, is that we see heavier and heavier cars that cause more pollution from tires, from brakes and these kind of things. We know these are toxic as well. I mean, keep this in mind as well. The other thing, what we see more in cities happening is biomass burning, the open fires, etc. These are things that, you know, we need to be aware of as well. And then the increasing role of agricultural pollution in cities, because of the pollution inside cities goes down from inside city sources, and then agriculture becomes more important. So these are very important aspects that we need to consider here as well, and keep in mind when we put this legislation in place. Thank you.
remarks. Thanks to everybody for coming, especially to our guests representing institutions, science, activists, people who know really, really well the topic. Thank you to everybody that come to share this space and listen arguments and exchange views. People representing also civil society, a lot of people from offices from here from the European Parliament, other institutions and NGOs. 3 important comments. First, it was mentioned, this is extremely interlinked to other files that we are discussing here in the Parliament. We have to ensure and guarantee that all its framework that it's coherent, obviously with zero pollution action plan, but not only this, all the European Green Deal. Secondly, it was a good comment, like we made a lot during the last decades on air quality, but this will be a signal of what we are able to do more. That the EU, the European institutions, has the knowledge and the capacities and the will to mobilize new tools. This is the lesson learned. And to be honest, also during the last decades, we know more about what is happening with air pollution. It's true that we improved, but at the same time now we have the World Health Organization and so on, the science telling us what is wrong about the air quality. And this is also acknowledged that we didn't have 2-3 decades ago. And then what we done, the successful story should be a tool to mobilize and do the step that we need, that it's an ambitious step, taking into account the figures, the numbers, the demands, and the awareness about what health implies for our society. And third, and my last comment also is, we need a legislation that is demanding and at the same time it's supportive for the administrations. This is something that I'm sure that the Council will be happy to listen. We need something that is also supportive, because I see also administrations that they have the committed to improve the air quality and they don't know exactly how. Because also it's a complex debate. All the important debates always are complex debates. And we need a tool that is demanding with the tools to enforce these demanding standards, but also supporting member states, regional governments, local governments who are doing a great job in this field, with air quality plans, with a set of policies that could improve the air quality. And for do that, and this is the homework after this change of views, we need during this year to all of us mobilize the will to achieve this. Like, you have a lot of networks, administration, civil society, and we have to mobilize the public opinion that this is something that we want that the EU delivers before the end of this mandate. And for do that, you will be key actors on this job. Thank you very much for coming.